I'm Dr. Timothy Johnston with your post-operative instructions for gum grafting with an AlloDerm membrane. AlloDerm, also known as acellular dermal matrix, is human cadaver skin. You were told that before the process got started, and you should be aware that that's what that is. Because of that, there are some special care instructions to be aware of. Number one, you need to decrease the swelling associated with that. You were likely given medications, possibly a steroid if it was a big graft to help with that. But you can also help by keeping the pressure on the area that we put on it with some gauze. We would have tucked some gauze under your lip and told you to keep it there and or change it every 15 to 30 minutes for the next couple of hours to sort of help just make sure the gums sit down where they belong and to decrease the swelling in the area. Applying ice for 10 minutes on and 5 minutes off for the next couple of hours will also help to reduce the inflammation. If it was a big graft, you would have also been given a steroid medication to help with the inflammation. AlloDerm tends to swell just a little bit after it's in place. We account for this during the procedure itself. But if the AlloDerm is playing a little peekaboo outside of the actual gum line, do not be concerned. If it looks like it's going to cover your teeth, that's a different story. That's not peekaboo. That's trying to climb out of the area. If that starts to happen, please give us a call. But if it's just trying to expose a little edge, don't worry, it'll resorb back in, especially once it starts to shrink again. You were given a prescription mouthwash called Paradex, or chlorhexidine gluconate is the generic form of that. It's important that you use that as instructed because you're not going to brush the teeth around that graft for a full week. Nothing at all, no brushing at all around the graft. Brush your other teeth normally, but avoid that like it was your job. Do not brush the gums at the gum graft site. The Paradex will do a great job of keeping plaque and bacteria at bay and not collecting on there. So while it sounds gross, it won't be too bad. You use the Paradex by putting about a half a capful from the bottle itself. Pour it into the cap. Do not take a slug off of the Paradex. Every time you do that, you activate the chemicals inside the bottle, and now you've got a bottle of already activated chemicals that's not going to be any good in a couple of days. So put a little bit in the cap, about a half a capful. Put that in your mouth and swish with it twice a day, trying to get it up into the area around the graft. Do not bullfrog your cheeks and lips though. None of this. I don't want you to look like Dizzy Gillespie playing the trumpet. I want you just to get the liquid to flow around there. In fact, if it makes you feel more comfortable, just dip a Q-tip into the solution and dab that on a few times. But again, don't keep dipping back to the bottle. Put a little bit in the cap or a Dixie cup and keep dipping back into that so you're not contaminating or activating the entire bottle. So for the first week, no brushing. You're using the Paradex instead. The second week, you may begin to brush gently, and I mean very gently. Just tickle the gums with your toothbrush and sort of roll off of the gums onto the tooth. If it's an upper graft, sort of roll from top to bottom very gently and then tickle with the edges. The third week, you may begin to brush with a normal motion, but again, a very gentle motion. After the fourth week, you may begin brushing fairly normally. If it's very tender, then back off a little bit. But after 3 weeks, you're usually pretty good. Eating. You're going to follow a very specific method of eating for the next 6 weeks. That seems like a long time, but here's what I need you to do. I want you to put everything that you eat into your mouth on either a fork or a spoon. There'll be no incising of anything. Obviously, if you were to bite into an apple, for example, that apple would sort of rake up over your teeth or rip up over it, loosen the stitches, maybe make the whole graft fail. But you can get the same result from eating a donut or a banana. It doesn't matter. For the first few weeks, it's really, really important. For the remainder of the 6 weeks, it's still important. So stay away from anything stiffer than a hot dog those last couple of weeks, but really go the full 6 weeks if you can with putting everything that goes in your mouth on a fork or a spoon. You can have pizza, you can have hot dogs, you can have hamburgers, you can have an apple, but put it in the back of your mouth and chew it up with your molars. Do not let it get up to the front and rake across there. Even then, for a little while, as long as it's tender, go with softer foods. Even if you are eating with your front teeth, stay soft until it feels good and strong. The stitches that were put in your mouth are long dissolve stitches. In other words, they take up to 6 weeks to dissolve. Again, reflecting the importance of keeping those gums in place and unaffected for the first 6 weeks. So they're very, very small stitches, very fine. They will dissolve on their own, but it does take up to 6 weeks, so don't be surprised to feel that. If you are having some discomfort, you'll know that we prescribe 2 over-the-counter medications to make you comfortable. It's going to be a combination of Tylenol plus Advil, and that's going to be taken at the same time. Don't leapfrog it like one now and one later. Instead, what you want to do is take 1,000 milligrams of Tylenol, that's 2 extra strength Tylenols, along with 600 milligrams of ibuprofen, or 3 Advil, in other words, and that combination of 2 Tylenol and 3 Advil has a synergy of like 2 plus 3 equals 10. It's just amazing. It works better at pain control and inflammation control, which is important, than the narcotics do, like Percocet or Vicodin. Our patients for the last 10 years have been telling us what a great combination that's been for them for these surgical procedures. If you have any complications or anything that doesn't look right, or you just have questions, please call the office. We'll be happy to get you in and see you as soon as possible. Thanks for watching.